Good morning. I am Rubina. Today is Monday, October 5th, 2020. India sees 100,000 COVID 19 deaths. What happened and what now? Leading health experts who analyze India's COVID 19 response so far and suggest the way forward. India has crossed the grim milestone of 100,000 coronavirus deaths, the third highest in the world behind only the United States and Brazil. Despite the South Asian nation's attempts to control the spread of the COVID 19 disease, which included one of the world's strictest lockdowns, infections have surged at an alarming pace. To date, India has more than 6.6 million cases, second only to the US. On Monday, it registered a single-day spike of 74,442 new cases, while 903 virus deaths in the past 24 hours took the total fatalities up to 102,685. However, the country's recovery rate stands at 84%, the highest in the world, with more than 5.5 million people recovered from coronavirus so far, according to the Health Ministry. Al Jazeera spoke to 4 leading health experts on India's handling of the crisis so far and what can be done in future to mitigate the spread of the respiratory disease. Sanmitraya, Center of Social Medicine and Community Health, Jawaharlal Nehru University, India. India currently holds the single-day record for the largest increase in cases, set on September 17th. As per the recent serological surveys done in the capital New Delhi and the financial hub of Mumbai, the ratio of infections to recorded cases are 21. Thus, India has more than 120 million COVID-19 infections, instead of the recorded 6 million. It is also evident the infection fatality rate IFR is as low as 1 per thousand. COVID-19 deaths add up to less than 1% of annual deaths from all causes in India. There have been 38 coronavirus deaths per million population, compared with more than 500 in the US. Mortality will spurt because routine health services including antenatal care and immunization have been disrupted due to the pandemic. The COVID-19 hotspots have dispersed from prosperous metropolises such as New Delhi, Mumbai, Chennai, Bangalore and Hyderabad, which have better health systems, to the hinterlands where health services are very weak. India's prolonged lockdown devastated livelihoods, causing acute food insecurity, translating into higher mortality and malnutrition, especially among children. The monetary relief from PM CARES Fund set up by federal government to fight coronavirus and announcements by the Ministry of Labor and Employment to safeguard jobs, wages and support the self-employed remain to be implemented. India opted for complete lockdown when the cases were low to save lives, but started unlocking when the numbers surged in millions for livelihoods. The hotspots were to be contained and not the whole country, which would have allowed people to travel home without perils. Students have been left to deal with the uncertainty of academic activities. Domestic violence has increased, causing anxiety and stress-related mental health problems. The government denied any community transmission of COVID-19 for a long time. The much talked about frontline workers remained exposed to the infection as well as the wrath of the state if they became critical of the government's crisis response. The recent accolades regarding the increase in the recovery make little sense as the COVID-19 has a recovery rate of more than 99% in India. The state seems to be more indulgent in image building than crisis management. Lockdown-induced restrictions on movement have created fear, leading to anxiety and panic. It is important to restore the trust that care will be available through restoration of routine services of all kinds. Students in institutions of higher education be brought back to the physical form of learning with due measures in common spaces like hostels and classrooms, without panic. Given the low fatality, most confirmed cases are mild and can be treated at home. So the stigmatization of positive case needs to be minimized through right communication. This will release the already burdened health services to deal with the severe and fatal cases. Prabhat Jha, epidemiologist, University of Toronto, Canada. India is not flattening the COVID mortality curve. Testing is affected by expanding test sites. However, since 80% of deaths in India occur in rural areas and mostly without medical attention, their causes of death are not known. Mumbai has most reasonable mortality data. The city is capturing most deaths and having physicians certify them. If you look at Maharashtra states where Mumbai is located, mortality curve, it is still not flattening. On the other hand, the growth rate of deaths in India is far slower than in high-income countries for reasons we do not know. The younger age distribution might be one factor. The lockdown in India was also accompanied by a mass exodus, but the government should have banned landlords from kicking out tenants in cities. These mostly young men went back to their villages, taking infection with them. In villages under lockdown, infection would be mostly confined to homes and not spread as much as if there were no lockdown. Thus, there might be notable but undocumented increase in deaths within homes in rural areas. To know this, restarting the million death study could be useful. The study takes a random sample of homes to conduct a verbal autopsy to determine the cause of death. To help this, the government may ask mobile phone companies to give metadata on where migration occurred from the big cities. In those rural areas, teams can be sent to find out the possible hotspots. In terms of what India is doing right and where it is lagging in terms of containing the pandemic, testing has expanded well, and availability of PPE kits seems to have improved. But data collection and dissemination must improve quickly. The Indian government must get all municipalities to release weekly total death counts for 2018 to 2019 and for the completed weeks of 2020. This is a simple way of seeing if the total mortality curve went up and is coming down. The Indian economy was already on a deceleration path, which turned into a catastrophic economic slowdown after the lockdown. The Modi government essentially gave up and, once again without any preparation, reopened the country when infection rates and deaths were rising. There has been inadequate investments in healthcare or helping families devastated by losses of loved ones and livelihoods. One of the biggest casualties has been the shutdown of schools. As it is, schools around the country had to contend with numerous challenges. But now children are getting their lessons online or over television. And when a family shares a single phone or a TV set, it is highly unlikely that children will get anything close to what resembles adequate education. The Modi administration seems to believe its Digital India campaign will solve the problem. Regrettably, Digital India has been a combination of a government branding campaign and a corporate campaign by a private player to dominate India's digital landscape, and the benefits have yet to trickle down to the people who are most in need of digital technologies. Thanks for watching TV Kabar News Studio.